Hello aspirant, I am Indumati Karthikeyan from InKar IAS Academy. Today we are going to see about the 28th November current affairs. The topic taken from the editorial view in Delhi edition, the ban on carcinogenic heartburn drugs. This topic comes under the GS2, issues relating to development and management of social sector services, and GS3, science and technology, and also comes under the preliminary topic. So this topic, why in the news, that is last month, the multinational pharmaceutical company GSK announced a record settlement that $2.2 billion in the United States in order to settle multiple lawsuits regarding one of its best-selling, that is a drug, acid reflux Zantac, containing active ingredient like ranitidine, after it was revealed that the drug contained high amounts of cancer-causing carcinogens. What is carcinogens? Carcinogens is nothing but a cancer causing agents. So in the N, nitrosodimethylamine is a contaminant that can be found in some medication including valsartan, losartan, then irbestron, and also ranitidine. The NDMA, the eptotoxic agent and carcinogen that can be produced during the manufacturing or introduced from the contaminated ingredient in the solvent. So this is the news comes under the discussion, that is last month these companies are giving these survey, that is a value testing findings said that according to the Valisur, the American pharmacy which first raised the issue testing of various brands of the ranitidine in its lab found NDMA in excess of 30 lakh nanograms in some sample, and also acceptable limit US was only 96 nanograms. Like all carcinogens, high exposure to the NDMA can cause cancer. The NDMA issue not specific, that is NDMA is a nitrosodimethylamine, that is a one of the agent that NDMA issue not specific to GSK. The high amount of NDMA have been attributed to stability issues with the molecule, while means that is not a GSK specific problem. Any problem manufacturer ranitidine will face the same issue. There is a regulatory action that United States Food and Drug Administration and the European Medical Agency stopped the sale of the various brands in the ranitidine in the jurisdiction as far back as 2020. That GSK itself informed Stock Exchange in India in 2020 that it was a withdrawing of the ranitidine products in India. Indian Ministry Health in Action, that is characteristically Indian Ministry of Health has taken no steps to stop these pharmaceutical companies from continuing to manufacture it to sell the ranitidine. So this is the concern. A widely used pharma drug. Actually, the government inaction on ranitidine sale in India, that is back 2021, after reports of Indian press pointed out how ranitidine will being sold in India. There were some murmurs from the government indicating that it was looking into the issue. The key question for the government, that is why did the Indian regulatory apparatus never respond to similar levels of impurities in the ranitidine which is widely consumed by Indian people? That is the second question. Why as a government not acted over the last 5 years is a similar vein as its counterpart in the West to stop the sale of the ranitidine in India, especially when there is enough substitutive like famotidine, cimetidine, esomeprazole, lansoprazole, omeprazole, although treat gastroesophageal reflux, that is a medical phrase of acidity that is need for identifying the responsible institution to answer this question. It is a first important to identify the key institution within government responsible for different stages of the regulating generic drugs. The chain of the standard settings are arise, but Indian Pharmaceutical Commission, that is a IPC or at the role, The task of setting standard, including acceptable limits of impurity and analytical methods for testing generic drugs for such impurities, lies with the Indian Pharmacopoeia Commission. But there is an autonomous institution under the Ministry of Health and the chaired by the Secretary of Health. In addition, in publishing Indian Pharmacopoeia, which lays out standard the testing protocols on different drugs, the IPC is also required to manufacture and supply the reference standard and impurity standard against the drugs such as ranitidine can be tested the quality control laboratories in the public and also the private sector. And also we need to ensuring compliance with the IPC standard. This task ensuring that drug manufacturer comply with the quality standard laid down by the IPC lies. First of all, the state drug controller responsible for issuing and manufacturing these license for such drug, and also the second thing, the drug inspection of the state and the center will randomly draw sample of drugs from the market for testing by the analytics in draw sample in government laboratories against the standard laid down by the IPC. The drugs fall to comply the IPC standards are deemed to be not to standard quality. These are the important thing. And also there is a key question for IPC, that is with the background, the key question to ask IPC or why they did not detect that NDMA issue ranitidine was exactly as it done since 2022. The laid down permissible standard for NDMA ranitidine along with the testing protocols. We cannot answer these questions because we have no access to copies of this latest version of for the Indian Pharmacopoeia. So it cost around 50,000 to purchase the most recent version of the Indian Pharmacopoeia recently. Ideally, it should be the available free given and also contains binding legal standards, and it's very important from a public health perspective. And also once the IPC set the permissible limits of NDMA in ranitidine, ideally the manufacturer ranitidine who cannot comply with the impurity standards laid down by the IPC either stop manufacturing ranitidine, the drug inspector prosecute these manufacturer and manufacturing not to standard quality. So this is a important key question for the IPC. And also we conclude that there is a separate the apart from the role of IPC setting standard, there is a question who in government responsible to acting prohibiting the drugs being sold in the market once a public health concern has been flagged anywhere in the world under the section of 26A the Drugs of Cosmetics Act 1940. Only the central government, or more precisely the drug regulation section within the Ministry of Health, has the power to prohibit the manufacture of the sale of drug in the country. The section in the ministry lacks the technical competence to perform the job. It's typically headed by the faceless joint secretary from the civil service who knows about the pharmaceutical industry or pharmacology. Perhaps it is now $2.2 billion settlement, $2.2 billion settlement for the Ministry of Health to swing into the action to issue order that Section 26A prohibiting with the immediate effect the continued manufacture for the sale of the ranitidine in the country. Thank you so much.